is LaShawn, and today I'll be demonstrating how to administer IV medication. The first thing I'm going to do is start off by collecting my supplies. What I have here are my gloves. I have my primary IV tubing. I have my patient, of course. I also have my medication label so that I can label my lines, as well as a bit of alcohol, a swab of alcohol. To start, I would knock on the door and provide patient privacy. I would verify the patient's name and date of birth, verifying it on his wristband. I would go ahead and make sure that I have already, or I'm in the process of respecting the patient's 6 rights of medication administration, which would be the right patient, the right drug, the right dose, the right time, the right route, and then finally the right documentation. I would verify the patient's orders once again. For this patient, I'm going to be administering 150 mLs per hour. In order for me to do that, I will have to determine what that would be, drops per minute. On my packaging here, they tell me my GTT, my drops are 15. So the way I would determine that is I would take 150, which is what's prescribed, times 15, which is the drop factor, and I would divide that by 60, and that would give me 37.5. Since you're unable to give half a drop, I would just round that to 38. So now I know I need to set my drip factor, my drip rate at 38 drops per minute. To begin, I'm going to perform hand hygiene. While I'm doing that, I'm going to ask my patient if they have any allergies. He has replied no, and I've also checked the chart beforehand. And I'm going to put on my gloves. Here I have my saline already hung, but I'm going to take it down so that I can begin the process of hanging my fluids. So here I have my tubing, and this is my spike and my drip chamber, my roller clamp. I'm going to go ahead and close my line, my Y line, and my adapter in, which will go into the patient. Before I spike my bag, once again, I'm going to go ahead and close my roller clamp. I'm going to take my saline here, and I'm now going to spike my bag. Now that my bag has been spiked, I want to go ahead and fill my drip chamber 1/3 or halfway. Okay, that's good. And I'm now going to hang my bag. When hanging your bag, you want to always make sure that you hang it at least 30 inches above the IV site. So that is 30 inches above the patient's IV site here. And I have already filled my drip chamber, and now I'm going to prime my line. In order to prime my line, I'm going to take my roller clamp, and I'm going to open it to allow the solution to flow. Making sure to get out any bubbles in the lines. You want to make sure you don't have any air trapped in your lines. Okay, now that that is complete, I'm going to close my roller. And now since we have already determined that the drip rate has to be 38 drops per minute, I will begin to count for 1 full minute, 38 drops, while I basically calibrate and set my drips. So I'm going to begin counting, and I'll be counting for 1 minute. Okay, now that I have determined that my drips are set at 38 drips per minute, I will go ahead and connect that to our patient, Mr. Bear here. And he can begin receiving some of his IV solution. Next, I will be administering some amoxicillin to my patient. The prescription, the doctor ordered 250 milligrams and 100 milliliters. I'm going to use a similar tubing that has a drip factor of 15 as well. So to determine what my drops would be, I'm going to take 100 times 15, and then I'm going to go ahead and divide that by 15, which will give me 100 drops per minute. Now, in order for me to administer the secondary medication, I'm going to obtain my secondary tubing. It's very similar from my primary tubing, but I'm going to go ahead and close off my roller clamp. I have my alcohol here, and here I have my amoxicillin that I'm going to be administering to my patients. We've determined that I have to administer this at 100 drops per minute, and it's going to run for 15 minutes. So in order for me to administer that to my patient, I'm going to take my tubing. Now, when it comes to spiking your tube, you want to always make sure that you never contaminate the spike end of the tube. You also want to take note to try to avoid contaminating the adapter portion of the Y line. So I'm now going to open my amoxicillin, and I'm going to carefully remove the spike, and I'm going to spike my medication. Now, just like your primary fluids, you must fill your drip chamber just about halfway. I've done that, and now I must prime my line. To do that, I'm going to open my roller clamp and allow my fluids to flow and prime my line. Make sure that there's no air in the line. Okay. Now I'll go ahead and close that. Whenever you hang a secondary medication or fluid, you want to always make sure that you are hanging it above your primary infusion so that the patient will receive the patient will receive this medication first. Because of the flow of gravity, the patient will actually receive the antibiotic at the rate that you have set it for versus your original fluid. So in order to set my medication, I have to similarly count 100 drops for 1 minute. So I need to set my flow rate using the roller clamp so that I can set it. So I'll be counting for 1 full minute now. Okay, and now that that has been set, I am going to connect the medication, the amoxicillin line, to my patient. And to do that, I will be connecting this to the Y-line adapter portion. I'm going to take my alcohol swab and I will be wiping off his adapter, his Y-line adapter portion. I'm going to very carefully and as thoroughly as possible take off the cap from the medication line and connect the two. And now my patient is receiving his antibiotic. The next thing that I will do is make sure that my patient is in a comfortable position. I'm going to inspect his IV site to make sure that there isn't any infiltration or any raising of the skin or anything like that. The patient states that he feels fine. I am going to leave him in a comfortable position, give him his call light. I'm going to remove my gloves. Once again, perform hand hygiene. Actually, before I would have removed my gloves, and actually I probably would have done this before hanging my line because it would have been easier, but I'm going to label the medication. I'm going to label it with the start time, the date, and what the flow rate is. Also, my patient's information, his room number, and my initials as well. I'll go ahead and label that on my line so that we know what is running in this line as well as how long it's been there. I would remove my gloves, of course, perform hand hygiene, and then I would perform any documentation that is necessary. And that would be it. Thank you.